Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Good morning. Good morning, everyone. Good morning, John. How are you?
Good morning, Dr. Lederman. I'm well. How are you?
Fine, thank you.
Good,
We're here
good.
with Coop and Aaron in the control booth at ABC. We're live and taking your calls. There's some new information this week. We promised to bring new information to our listeners, and one of the articles that came out this week is about what fruit is best to eat to avoid diabetes, actually.
I'm a diabetic, doctor, so this is this content is interesting to me
Right.
already.
Well, I think it's interesting to everybody because you always wonder what to eat. People are interested in vitamins, and we're going to have a special show tomorrow night on WOR at 9 p.m. about an expert in the field, Dr. Paul Ofit, who's from the University of Pennsylvania. He's going to be talking about vitamins, megavitamins, oxidants, antioxidants. But there's a new article about what fruits are better than other fruits to try to avoid adult-onset diabetes, type 2 diabetes. Right. So we know that eating fruits is good for you, and an article that came from the British Medical Journal looked at 185,000 people. And they followed these 185,000 people over 12 years and then tried to find out who developed type 2 diabetes in that 12-year period. So it's interesting, in 12 years, how many people would you think developed type 2 diabetes out of 185,000?
Out of 185,000 over 12 years, I'm going to go with, let's say, 2,000.
Yeah, well, it's actually more than 12,000 people.
More than 12, wow.
Yeah, so it's really, really
significant
pretty
number.
serious business.
Sure.
And diabetes has a lot of consequences to the heart, blood vessels, eyes, kidneys. So they looked at what kind of fruits people ate and looked at strawberries, oranges, peaches, plums, apricots, and none of those made any difference.
Yeah, interesting.
The people that ate them versus didn't eat them didn't make a difference. But actually, luckily for me, once in a while I hit the bullseye. Grapes, apples, and grapefruit reduced the risk.
Is that right? Okay.
And the biggest winner, which is my biggest favorite fruit of the year, is blueberries.
Blueberries. The sleeper there, the sleeper fruit.
Well, I don't know. It's not a sleeper in my house. In my house, we go through pounds and pounds of blueberries every season, each week, every season.
And you're not a diabetic, are you, Doc?
No, I'm not a diabetic.
So it seems to be working.
Well, I don't know that. But the researchers found that eating 1 to 3 servings a month decreased the risk by 11%. And if you had 5 servings a week, it decreased risk of diabetes by 26%.
Pretty bold.
So blueberries was way out there. Fruit juice, substituting fruit juice for whole fruits, actually increased the risk of diabetes. And you'd think that because fruit juices are just filled with oodles of sugar, right?
Yep, for sure.
I mean, you probably know that.
When my blood sugar's low, I go right for the orange juice.
Because you want to get sugar up.
A quick response
to
the low.
That's an emergency situation.
Yep, for sure.
But if it's not an emergency situation, you probably should stay away from all those fruit juices, even orange juice.
Yeah, that's right. That's right. Yeah, I would say it's a great way to bring the sugar up in the short term. For the long term,
right. You don't
nothing replaces a meal. And,
that's right.
And right calories.
In the cancer world, there's a new drug that's been approved for pancreas cancer. Pancreas cancer is one of the big diseases that affects Americans, and a new drug is out called Abraxane. Abraxane has been used for other cancers. Abraxane is a known chemotherapy. It's called Taxol, but it's hooked on to molecules of protein of albumin. So it fights the cancer in a different way. For pancreas cancer, there's 45,000 cases a year in America and 38,000 deaths. So it's the 4th leading cause of cancer death. So it's high up there with lung cancer and breast cancer and colon cancer. People with metastatic pancreas cancer on average live a half a year. We have a unique program in our facility using stereotactic radiosurgery, and when we treat, even with 5 treatments to the pancreas or a metastatic site, our success rate, meaning to stop or shrink or control that pancreas cancer, is about 90%. So chemo is good. Chemo is very expensive. The average price for Abraxane is $6,000 to $8,000 a month.
Wow.
So it's a pricey drug.
Now, is that a tablet, doctor, or?
I think it's injection.
Injection, okay.
Mm-hmm.
Okay.
It's an injection. It's a novel form of Taxol, and it adheres to albumin, which is a protein that the liver makes. It's normally in the human body. And by being attached to the albumin, it decreases the side effects. So there are other drugs that are used for pancreatic cancer, and maybe even with better results, but there's more side effects. So this is a drug that has some benefit and less side effects, and it increases survival compared to gemcitabine, which is the usual drug with the 6-month survival. This is about 8.5, so about a third better with good control of side effects. So again, we often will combine chemotherapy with radiosurgery for pancreas cancer. Sometimes patients come to us and they've already had chemotherapy and it just didn't work.
Right.
And we take on the patient, often consider treatment in the pancreas. The next site usually spreads through the bloodstream to the liver and sometimes to the lymph nodes around the pancreas. So we're able to pinpoint the cancer.
Right.
Radiosurgery is a non-invasive method of treatment, so it's a misnomer. It's not really radiosurgery, but the inventors back 50 years ago wanted to let people know that it's pinpoint like a surgeon's knife without the cutting.
Gotcha.
So radiosurgery means radiation beam. Surgery means pinpointed, but it's totally non-invasive treatment.
Gotcha.
And our group was the first group in America to do stereotactic body radiosurgery. And we've done about 20,000 cases.
Wow.
We're live on ABC. We're here in the studio by Penn Station and Madison Square
That's
Garden,
right. Right above MSG.
And we're just a few blocks away from our office. Our office is at 38th Street and Broadway. We have one of the largest private offices anywhere that is devoted to patient care for those with cancer. The studio phone number, if you want to call in a question, is 800-848-WABC. Again, it's 800-848-WABC, which the real numbers are 800-848-9222, 800-848-9222. And if you have questions, you're welcome to call in. If you'd like to get the free booklet and DVD, you can just call in and leave your name and address, and we'll mail it to you during the week. There's a lot of interesting cases that we saw this week, and I wanted to bring up those cases of patients. I had a man walk in, 84 years old. It looks like he's about 64.
Good for him.
He said, "Doc, do you remember me?" And I said, "Maybe." And he said, "Well, you treated me 19 years ago."
Wow, 20 years.
Okay, 19 years. I treated him in 1994 with prostate cancer. He had brachytherapy plus a short course of radiation. We were pioneers in the field developing that technology. And we have comparison data. So men with prostate cancer, I show them the data. You can have whatever you want. You can have proton beam, and we'll show you why we're better. You can have open surgery. I'll show you why we're better. But this man came in 19 years later. He hadn't been followed recently. We got a PSA blood test. PSA blood test is prostatic-specific antigen, and usually coincides with the amount of cancer in the body. So as the cancer goes away, it should go down to 0. So he was very curious how his PSA was 19 years after treatment.
Right.
And he's doing perfectly well. He heard our voice on the radio, and his daughter actually encouraged him to come in for a checkup. And
awesome.
he was good. Happy. He said, "I didn't change a bit, but I think maybe he needs a new prescription of
right.
eyeglasses." Anyway, his PSA was 0.